Hi, hello. Thank you for watching this video. This is Nurse Choma. Today, I am going to talk to you about how fish oil helps to improve patient outcomes, pregnancy, as well as also the outcome of fetal and the baby. And this is actually something that I think is very important for us to know as nurses. Like we should have a great understanding of not just pharmaceutical options, but also we should also know non-pharmaceutical options because you may encounter and you will encounter different walks of people who don't want to necessarily take medications. And then on the other side too, you need to be able to educate your patients and you need to understand why we are giving them what we're giving them. So in this broadcast, I'm going to talk to you specifically about omega-3 fatty acids. And omega-3 fatty acids are actually not the same thing as omega-6 fatty acids. Omega-3 is the good one, omega-6 is the bad one. And so today I'm going to share with you like why they're so important. So tag somebody or share this video who you believe may benefit from this information. So first and foremost, I need to say a disclaimer because anytime you teach on something that is based on medical research, I have to put a disclaimer. So the statements contained in the following presentation have not been evaluated by the FDA, so the ingredients discussed are not intended to diagnose, treat, cure, or prevent any type of disease. Okay, so now let's talk about essential fatty acids, all right? Essential fatty acids. So ALA, all right, and this is one thing you'll learn is that there's multiple different types of abbreviations. Let me see. Hold on. Let me make sure that you guys can see everything clearly before I continue. Okay. Okay, there we go. Yes, you can. Okay, so ALA is deemed essential because of its apparent benefits in animal studies. So later they found that DHA provides health benefits to the eye and the brain. ALA is converted to DHA. All right, so when you hear the word essential fatty acids, you want to equivalent that to ALA. And so that ALA or that essential fatty acid in the body, it's converted to DHA. Okay, so it's important to understand this is all also important because you have to understand how your body metabolizes and processes food or anything that you consume. So here's the thing, our bodies cannot make our bodies make DHA, but it's not able to produce enough of it, all right? Hence the reason why the doctor says, you need to take omega-3. So we have plant and marine sources of omega-3, all right? Vegetable oils, they contain significant ALA. All right, vegetable oils contain significant ALA, but not EPA or DHA. So when somebody says, okay, I'm just going to get my omega-3 from, getting vegetable oils over the counter, I'm going to put them in my food, what they don't understand is that you're not going to get enough of it. All right. So fish oils, however, they have a concentrated EPA/DHA and trace of ALA. So when we look at the typical American diet, this provides about 2 to 3 grams a day of ALA, all right, and 50 to 80 milligrams per day of EPA or DHA. All right, so we're only getting 2 to 3 grams and just 50 to 8 milligrams of DHA, which is the essential fatty acid that we need, that our body needs to consume. Okay, so here's the thing. DHA, these are the benefits. This is why it's good for us to take it. So I'm talking to you not just only from a perspective of somebody that is a nurse, but also for yourself personally. Whether you're 50 or 25, it's good to take it because it's required at high levels in the brain and retina for optimal learning ability and mental development and visual acuity. So DHA, it helps to improve your ability to learn. It helps to improve your mental development, right? And so for those of you who are in a position where you feel like you're struggling to comprehend, you're struggling to learn the material, like you took in your exam multiple times, whatever your situation is, you may want to consider not just doing outside resources, but also evaluating your personal health, right? And by consuming DHA or omega-3, it's going to make you sharper so you can learn a lot of material, so you can study more effectively, so you can comprehend what you're learning, and you're not spending hours studying the same thing over and over again. Here's another thing about DHA or taking omega-3 fatty acids. They support cardiovascular health. So this is the number one reason why we prescribe them to patients, is because a lot of patients suffer from very poor cardiac or heart conditions, right? So as a result, they need to take fish oil every single day. So what about pregnancy, right? How does this influence pregnancy? So when we look at pregnancy, if it's taken to support the health of the baby, it's taken to support the health of the baby during the neonatal period. So I really want you to think about this, because remember, when a woman is pregnant, what is she supposed to consume? What is she supposed to take? She's supposed to take her prenatal vitamins, right? And these prenatal vitamins are going to support a healthy baby. So she takes she's supposed to take this in order to help, especially it's taken primarily during the last trimester. Now another suggestion could be, well, why not she just consume fish, right, in her diet versus taking fish oil supplements, right? Well, the thing that you have to be cautious of is that consuming fish can be risky because of mercury, right? So there are a lot of fishes that contain traces of mercury, which over time can become toxic to a fetus, right? To a pregnant woman. So, and this is just for everybody as well, right? So you have to be, if you are a pescatarian, if you only consume fish, you need to be mindful of what type of fish you are consuming, because they do contain some fishes, not all fishes, contain mercury. It's recommended that while she's pregnant, she should take at least 300 milligrams of DHA per day. All right. Remember, this is all with her prenatal supplemental recommendation. So there are some clinical trials, though, that show that women with higher DHA, so here's how it benefits the baby's outcome. There are clinical trials that show that women with higher DHA intake have infants with higher cognitive development scores and children with higher IQ scores. Isn't that interesting? So there's studies that show that when pregnant women consume more fish oil, consume more omega-3, it actually correlates to sharper development, cognitive development, and higher IQ scores in the children. Very, very interesting. Now, there's also evidence as far as the mother as well. There's evidence that mothers with a higher intake of DHA, they give birth to infants with improved sleep patterns, right? So if, I don't know about you, but if the baby is sleeping better, the mom is sleeping better, right? So this is excellent, right? Because if taking DHA or fish oil, right, these fatty acids is going to improve the sleep patterns of the baby, then, especially when those first 6 months, right, when the baby cries a lot, and it's very difficult, right? So taking DHA actually helps to improve the sleep patterns of the baby, as well as, of course, ultimately the mother. So here's the thing about not consuming enough, because one thing that we don't understand, honestly, is that a lot of problems that we have is because of not consuming enough vitamins and minerals on a daily basis. All right. A lot of health conditions are the result of low consumption of your adequate daily vitamins and minerals intake. So low omega-3 intake is actually linked to depression and pregnancy, right? Low omega-3 intake is linked to depression and pregnancy. So women that consume 1,500 milligrams, that's how much the recommended is. Women that consume 1,500 milligrams of omega-3 from seafood per week were less likely to have depressive symptoms than those consuming none. That's very interesting, especially if it's in your family where, you know, a lot of women experience postpartum depression, that's common in your family, or if it's just your first pregnancy or whatever the situation may be. But there's a very strong research that shows this. But remember, you have to keep in mind, though, at the same time, that you don't want to take too much seafood because it may contain mercury. Hence the reason why it's a better approach to just take fish oil and take fish oil that is high in value and high in the omega-3 concentration to reduce that likelihood. So I'm going to show you this diagram, or this graph actually, that hopefully will really hit some things home. So this is showing you the correlation between postpartum depression and fish consumption. So over here on the bottom is fish consumption. So how much of fish that they're taking, which contains, you know, omega-3 fatty acids. And then over here is the frequency or the percentage of postpartum depression. So this is what's interesting. So if you look down here, Malaysia, like Singapore is extremely low, right? They consume about 80 pounds of fish, normally, and look how low their percentages of postpartum depression. Malaysia, right? A lot of Asian countries, there's people are not depressed, right? Because they eat differently than we do. So if you look here, Malaysia, look at this, 60 pounds of fish. They're 2.5% of depressed postpartum women. Japan, look how much fish that they take. Over 140 pounds of fish per year, per person. And look how low their depression rates are. Same thing with the Hong Kong. They take about 130 pounds of fish, and look, their depression rates are about 5 to 6%. But then if we go up here, look at us, the United States. We only take about 40 to 60, so about maybe like 50 pounds of fish, which contains omega-3 acids, and look how high our postpartum depression rates are. 17.5%, a lot significantly higher than over here in these more Asian countries. Same thing over here. South Africa is huge. Very little fish consumption, but yet very high postpartum depression. Very high postpartum depression. So just by studying this graph, right? Just by studying this graph, you can see how much of a strong correlation there is between fish consumption or consuming omega-3 fatty acids versus postpartum depression. Hence the reason why it's so important that we encourage our patients to take this. Hence the reason why it's so important that you take this, right? You as an individual, you as a person, right? You as family member, if anybody in your family is pregnant or going to be pregnant, this is why you should take your prenatal vitamins, right? This is why you want to be proactive with it. But a lot of people, they just resort towards, just taking the simple over-the-counter, just taking whatever is prescribed later versus making choices now, right? So this, to me, this is very interesting. To me, this is very interesting. So higher intakes of DHA, right? DHA or EPA during pregnancy, 150 plus milligrams per day, have increased birth weights and reduced risk of preterm delivery. That's another benefit as well, that it reduces the likelihood of preterm babies, right? So that's important, especially if it's a common thing in your family or your family's families or other people that you know or people that you encounter or take care of. So there's an increased birth weight, which means that they're going to be healthier. So what about the lactation period once now the baby comes out of the womb? So the level of DHA in breast milk is very low because fish is only consumed about every 10 days. So women consuming about 11,000 milligrams per day, they still have very low DHA in the milk. All right. And then taking 300 milligrams of DHA, it elevates breast milk levels from 0.14% of total milk fats to 0.39%. To 0.39%. So here's the thing: supplementing with 200 milligrams a day of DHA for 4 months after delivery resulted in higher scores in the Bayley Psychomotor Development Index at 30 months of age. So it's not just benefiting only during the pregnancy stage, but look, it's still benefiting the children even afterwards, right? After they're at 30 months, years of old, right? So this is why, and then one thing I will say is that this is a much significant transformation, right? Then let me just take, a bunch of pills or something, right? This is more significant. Like imagine that this is having this much of an effect in their cognitive health, in their mental health, in their IQ, right? In their ability to focus in school. All this stuff really matters if you really want your children to grow in healthy environments. So there's a positive correlation between mothers supplementing with fish oil, DHA, during that lactation period and their child's visual acuity at 4 months. So also as well, their visual acuity is sharpened because the mother is consuming fish oil. That is amazing, right? Especially if it's if it occurs in your family where a lot of people in your family have poor vision, then you should be consuming more fish oil, right? You should recommending it to more fit to other people, right? So, and what I'm going to share with you. I'm going to say, make sure you stay tuned until the end. I'm going to share with you a fish oil product that I recommend. This one is not like your typical thing that you find over the counter. It is much higher in concentration, potency, quality, and it doesn't contain additional fillers as well as very small traces of chemical agents that you see in other over-the-counter fish oil products. All right, and then if you find this helpful, please tag somebody or share this video. I typically share this on my Facebook page, my wellness page, which is called Health and Wellness with Nurse Choma. If you want to learn more stuff like this, follow that page, Health and Wellness with Nurse Choma. Okay, so pregnant and lactating women. So this is from the World Association of Perinatal Medicine, and they say that pregnant and lactating women should get about 200 milligrams of DHA per day. All right. Now, and then the infant formula should contain about 0.2 to 0.5% of DHA of total fat. Babies should actually continue taking omega-3 after the first 6 months of life. So this is why if you just gave birth, right, or you are working with someone who just gave birth, or you're following them, whatever the situation is, they should keep taking fish oil even afterwards of the pregnancy for the first 6 months. And as they breastfeed their child, the child's going to continue to benefit from that, right? Because the child's not going to take omega-3 typically because they are a baby, right? They're going to take it through their breast milk or infant formula. So infant formulas contain 0.36% DHA, which have improved performance on, once again, their mental development, their memory, their problem-solving skills, their vocalization, and their math skills. So just really evaluate this whole picture, because if if you have a child or you know somebody who has a child, and imagine the challenges that you experience because they're struggling in school, because they're struggling in math. This is added time that you're spending to have to go to the class and talk to the teacher about their performance, right? This is more time to spend to show them how to do the math formulas, and you're saving more time because your child's mental development is stronger. Saving more time, and then plus your child's not gonna get frustrated. I know when I was younger, I got very frustrated with learning certain things. Like certain things, I'm like, man, I don't get it. I don't want to do this no more, right? And so, and they don't know what to do differently. They're trying their best. So why not change what they're consuming? And unfortunately, this is the reason why people in lower income communities, you're like more minorities, or communities where it's poorer communities, we're not doing as well because we're not aware of how important it is to take our supplements and eat in a certain diet so that way we can see better outcomes. Another thing as well, here's the thing, this is so profound. If you have ADHD, or you have a child that has ADHD, or you know someone has ADHD, it shows that children with ADHD, they have low blood levels of DHA, which is essential omega-3 acid. So remember, and children with ADHD, they struggle with focus and retention, right? And look, their levels are low. So this is what they did. They did a study, all right? So there's a study where they use functional food sources of omega-3, providing 514 milligrams of DHA and 100 milligrams of EPA. And here's what happened. It showed a significant reduction in their aggression. Significant reduction in their aggression just because they started taking more omega-3 fatty acids. Look at all the benefits of this, of taking this one supplement. So increased EPA levels, it helps with ADHD symptoms, right? Like I said, if you know someone has ADHD or even autism, or has a child with autism or a child with ADHD, tag them in this video, encourage them to watch this all the way to the end. So they did a study. They took 90 children that had ADHD, which were aged 9 to 12 years old. It was a randomized controlled study. And they found a correlation, the researchers found a correlation between increased EPA levels in blood and lower oppositional behavior, hyperactivity, and overall ADHD symptoms. That is huge. So just because they took omega-3, their behavior improved, they were less hyperactive, and their overall ADHD symptoms were also significantly decreased. And here we are, we're frustrated trying to do other things when there's studies that shows things that actually do work. It also boosts memory in healthy young adults. There was about 176 participants. They also, 176 people who are 18 to 45 years old participated in this study, and their habitual diets, so meaning their regular everyday diets, were very low in DHA. So what they did for about 6 months, they took 1 gram, 1.16 grams of DHA every single day. Here's what happened. The men who consume this, 15% faster working memory. All right, meaning that each man, they noticed that their memory improved by 15%. The women, they noticed that they had a 7% improvement in the speed of episodic memory. So the cognitive functions affected are among the most important functions of our brains for everyday activities. So if you find yourself saying like, oh, I'm getting old, or oh, I forget stuff easily, or oh, whatever it is, take omega-3, right? That's going to improve your memory, your ability to sharpen your memory. And now I almost wonder if there's a study. Maybe I'll find it one day a study on Alzheimer's disease and taking DHA, taking omega-3 acids. So omega-3s, they prevent all causes of adult mortality, CVD events. So they use a placebo with 563 men that was 64 to 76 for 3 years. And they did diet counseling plus 2.4 grams of EPA plus DHA per day. Here's what happened from doing this study. The omega-3, it reduced all-cause mortality by 47% and their heart attack risk by 11%. That's huge. So it significantly reduced their ability of dying and developing a heart attack. So what about people who suffer from high triglyceride levels, right? And remember how one thing that we do, what do we do if they have that? We usually give them statins, right? So we give them like atorvastatin. That's a very common one. Like we give them statin medications to help lower their cholesterol levels. Well, here's the thing. Fish oil is also very effective at lowering triglycerides, and it's also, of course, natural, because if you take statins, which is a medication, pharmaceutical medication that the doctor will prescribe. However, though, statins do contraindicate with grapefruit juice. Statins also contraindicate with other types of foods that when you consume them simultaneously, it will decrease the potency of that statin, meaning that it won't work as well. Versus fish oil does not have any of those contraindications. That's the difference. So it will lower it lowers triglyceride levels. They consume about 2 to 4 grams total per day, and it lowered their levels, look at this, by 30 to 50%. Huge. And it can be used in combination with statins, right? Along with, of course, the doctor's supervision. Right, meaning that if you're taking 2 different things that helps to lower the triglyceride levels, then the doctor should be aware of it, so that way he can monitor if it's, if it's too potent or too much, right? So if you're going to take fish oil and you're on statins, you should notify your doctor as well. So here's another study as well. There's another graph: fish consumption and the annual prevalence of major depression. So once again, depression though now, right? Not postpartum depression, but depression generally. Japan, Taiwan is winning, right? They consume about 80 pounds per year of fish. Japan, 140 pounds per year of fish, and no depression, 0%. Versus over here, United States, we only consume about 40, maybe 45%, 40 pounds of fish, and we're looking at about 3%, so a higher prevalence rate of depression. So it's sad too, honestly speaking, because you see so many suicide rates in the United States, right? So many people are depressed, right? But we eat terribly, and we don't take care of ourselves, right? And we don't take supplements, we don't take vitamins, and we wonder why we're struggling in our health, right? So, but however, though, like other countries, third world countries, they're doing a lot better because they value their health more than we do, right? A lot more. They're willing to invest in their health, right? And that's why they live longer. That's why they have sharper skills. That's why they're wealthier, because they're willing to invest in their health first. Here's another study, all right? This is an age-related eye disease study. Once again, share this video, tag somebody, or if you're watching this on the replay, invite somebody to watch this video later, all right? So they did a study, and there was an average intake, all right, an average intake where they took 64 milligrams a day of DHA, all right, which is omega-3 fatty acids, and 42 milligrams per day of EPA. And look at this. They saw a 27% reduction in age-related macular degeneration. That is so significant, because you have especially with those of you that are nurses, you have patients who will have over time problems with their vision, And they may have peripheral macular degeneration, which is where they can't see past the corner of their eye. They literally have to turn their head in order to see the whole area. So look at this. This is so significant. So here's what I would tell you as well. For those of you who are, if you're a nurse practitioner or you're a physician that maybe I may get some resistance with doctors, to be honest. But also like this, if you're a nurse practitioner, if you own your own medical practice, you really want to start pushing your patients, regardless of the specialty that you're doing, start really pushing your patients towards taking omega-3, right? Because it's really they're gonna see, especially if they're early, they're young, and when I say young, I mean they're in their 40s or 50s. Because they're going to see a significant improvement in their overall health. And if they do better, right, depending on what your specialty is, but if they do better, though, they're going to want to continue to spend more time working with you. They also took the military, the U.S. military, and they also noticed that soldiers. Now this is so profound. Like I think I really want to. I think maybe I want to start an initiative, because this would be wonderful. But anyways, though, they looked at soldiers, people in the military, and they noticed that they had a very low DHA level. And they were at a 62% increased risk of suicide. Isn't that interesting? Because if we really was to evaluate every point of contact in our U.S. system, and a lot of it stems back to our health, right? Because if our soldiers are not doing well, how are they going to fight in combat, right? How are they going to be able to do the things that they need to do, right, in the other third world countries, right? And now it's also affecting back at home. Very interesting. So they were encouraged to start taking fish oil in their diet. It protects against brain aging. So here's the dementia study. There was a study about 1,500 dementia-free people. All right, they were about age 67. They went through an MRI brain scan and they measured their omega-3 fatty acids in their red blood cells. People with the lowest DHA levels had low brain volume. Isn't that interesting? Which correlates to eventually, of course, developing degenerative disorders such as dementia. So because they were not taking enough omega-3 fatty acid in their diet, their brains appeared to be 2 years older and their brain volume was less. Very interesting. Very, very interesting. Here's another one, omega-3 and inflammation. Okay, so IL-6 and TNF-alpha is related to CHD, depression, type 2 diabetes, arthritis. They took about 138 participants that were aged 40 to 85. 95% of them were overweight. 47% were obese. There's 3 groups. One group took 2.5 grams a day of omega-3. The second group took 1.25 grams per day. The third group took a placebo, and they did this for 4 months. Here were the results. From doing this study, the omega-3 group, their IL and IL-6 percentage went down by about 10 to 12%. All right, so these are their inflammation. This is all related to inflammation. All right, so I know it's all medical terms, but pretty much their inflammation markers decreased significantly. But the people that were in the control group who did not get the omega-3, it went up by 36%. That's why we're complaining of the inflammation. That's why we have the chronic pain. That's why we keep having the heart problems. That's why it's progressing and getting worse, because we're not taking omega-3. So here's a conclusion. I think by this point, it's pretty self-explanatory. We got to start taking omega-3 acids. We need to take it every single day, no matter where you are in the state of life. And we need to recommend it to our patients. We need to recommend it to other people. We need to encourage people to do it. If you love somebody, tell them. And you do it as well, right? So here's the conclusion. DHA, it is so, I can't hit enough. I really hope that this opened your eyes. and compelled you and encouraged you, because DHA is essential for growth, right? For functional development of the brain in infants. It is essential for the visual acuity of healthy, full-term formula-fed infants, right? Which is increased when the formula includes DHA. Once again, DHA just simply means omega-3 acids, all right? It's converted, when you take omega-3, it's converted to DHA in your body. It decreases in DHA, however, are associated with cognitive decline and aging. There's a strong correlation between fish consumption and a reduction in sudden death from myocardial infarction. So here's what I would recommend, all right? I would highly recommend take this. This is my own product that I recommend. This is our Heart Health Omega-3. You're not going to find this anywhere else. This is a much higher concentration, much higher quality of omega-3 fatty acids. Now that you've seen the benefits and you've seen why it's so important, I would highly recommend to give this a try, give this a shot. What this will do, it will help to maintain those normal cholesterol levels. Also, it's going to help to maintain healthy blood pressure levels, because if your arteries are clogged with fats and oils because of your diet, then it's going to increase your blood pressure. So by decreasing those fats and oils clogged in your arteries, your blood pressure is going to be maintained. It's going to help to maintain normal blood flow. It's going to help, which is going to prevent the heart attack risk. It's going to help to maintain normal triglyceride levels in the blood. Right? It's going to help to maintain healthy levels of C-reactive protein. All right? This is one of our top 20 customer favorites. It's product tested. There's no GMO. To get this up, I would recommend this one, because if you go, for example, to CVS or Walgreens, what you don't realize is that a lot of those supplements that's over the counter, they were made in different countries, right? China, India. And what you don't understand is that because they were made in different countries and they've been shipped here, they had to add certain type of preservatives or other type of elements in order to maintain the quality and the shelf life of that product. So you're taking their omega-3, but then at the same time, you're also taking their fillers. You're also taking their additional preservatives as well, right? And there's some, I remember there was a recall done, I'm not going to say what company, but it was a very common supplement that's over the counter. This, however, though, it's made right here in the United States. It's made here in the United States. That's what makes this different. As soon as you get it, it gets shipped to you immediately, right? You should get it within 24 to 48 hours. Higher quality, more potent, right? So much more valuable, amazing testimonials of people who've seen significant results from taking this particular supplement. And it also contains vitamin E, all right, which most fish oil supplements that's over the counter does not. All right, so vitamin E is important because vitamin E is also helps with antioxidants, which helps to reduce the risk of free radicals, destroying or damaging the cells in your body. So if you want to get this product, go to I put the link in this video, but go to bit.ly/fishoiladvanced, bit.ly/fishoiladvanced. Another thing that's different with this one versus over-the-counter supplements is that it contains 3,000 milligrams of fish oil. 3,000. Most over-the-counter fish oil products are three times less than that. So this contains 3 times more fish oil than most other fish oil products. And in addition to that, remember, think about this too. When you look at fish oil, you have to remember where they're extracting it from, what type of fish that they're getting it from. So if they're getting that type of fish over the counter that you get over the counter from fishes that contain high concentrations of mercury, how is it really benefiting you? This one, however, though, we only use the best fish to provide a clean and safe product rich in EPA and DHA, and very low, if minimal, if nothing, in toxins. So I would recommend this. Give this a try. Get started on it. If you know you have health problems or heart problems, or you want to be proactive. I myself, I'm healthy, but I take this though because I'm serious about my health because I want to live a long time, right? And I don't want to complain about health problems like other people. What I would do is that if you do purchase this particular product by Friday, because today is Labor Day, if you get it today, I will give you a coupon. All right, this is a time sensitive video. So if you're watching this right now and it's past that day and you're wondering why the coupon code doesn't work, it's because the coupon is over. All right, it's already expired. But if you're watching this right now, you can get it today if you use the coupon code 10 off MA, like the number 10, the letters, capital letters, OFFMA. You can get the smaller version or the large version, and it will last you for a very long time. Okay, 10 off MA, you get 10% off. All right, so that's it. Once again, if you find this information helpful and you want to learn more specific topics like this on health and wellness, like you care about your health, right? You want other people to care about their health. Follow my Facebook page, which is Health and Wellness by Nurse Choma. All right, Health and Wellness by Nurse Choma. And then share this video, tag somebody, let somebody know. Heart up the video, like the video. It tells me that you enjoyed the information as well. And then if you want to get this fish oil product, once again, go to bit.ly/fishoiladvanced to try this out. It will not disappoint you. All right, it will not disappoint you. All right, so thank you so much for being here. Thank you, Marie. It helps you. It's effective. Thank you for saying that, Marie. I hope you have a wonderful day, and I'll talk with you guys later.